Okay, so on the table here we have a whole range of oxygen delivery equipment. I think a good place to start when we are considering oxygen therapy for our patients is just to be familiar with the equipment itself and what it does and what flow rates are appropriate for which device. So just might sound really obvious, but I'm just going to point out a few things here. So this is some oxygen tubing, okay, obviously quite essential. This here is a nebulizer mask, and you'll notice that it has a secondary component that comes apart that's known as the nebulizer chamber or the nebulizer bowl. We've got a non-rebreather mask, all right, also called a reservoir mask, okay, obviously because the bag is a reservoir. This here is a simple face mask. Its other name that it's commonly called is a Hudson mask. It's good to be familiar with both names in case people use different terminologies. You'll know what they're talking about. Here we have some nasal speculum or nasal cannula. Sometimes they're even referred to as nasal prongs. Okay. And this here is a Venturi mask. And then you see a nice rainbow assortment of the Venturi apparatus itself. And of course the color-coded system is quite important to get right. The easiest way to know which device delivers which concentration of oxygen is just to see what's printed on them. So I happen to know that white is the least concentration and it's 28%. And that's at 4 litres. All right. So if we want to attach one of these apparatus to the mask itself, it's just a push together type maneuver. All right. And then as a secondary maneuver, we apply our oxygen tubing at the end there. Okay. Golden rule of all oxygen delivery devices is that you have them fully assembled and plugged into your oxygen source and your selective flow rate running through the line before you actually attach it to your patient. There's no point in putting a patient's, for example, a Hudson mask on a patient's face and then working backwards, trying to attach the oxygen tubing and then trying to attach it to an oxygen source and then dialing up the oxygen flow rate. It's a bit inefficient to do it that way. And also the patient's breathing a lot of dead space within the system before they get the fresh oxygen supply. So have the fresh oxygen supply flowing through it first. Alright, so the next couple of videos we're just going to go through each of these devices in a little more detail one by one.